Hello and welcome back to Vet Care. Today we are talking about toxemia and endotoxemia. These are systemic conditions in animals where toxins circulate in the blood and damage multiple organs. Toxemia means the presence of toxins in the bloodstream leading to organ or system dysfunction, but it does not include poisoning from plants, insects, or ingested chemicals. In clinical practice, most cases of toxemia are endotoxemia. It is the most common form, especially in large animals, and is caused by lipopolysaccharide toxins from gram-negative bacteria such as E. coli, Salmonella species, Pasteurella species, and Haemophilus somnus. These toxins disturb heart and lung function, alter white blood cells causing neutropenia and lymphopenia, and reduce platelets leading to clotting disorders. Vascular permeability increases and blood flow to organs decreases, which may result in heart and kidney failure. Gastrointestinal motility is reduced, and poor blood flow to body tissues can lead to shock. Toxins are broadly classified into antigenic and metabolic types. Antigenic toxins are produced mainly by bacteria and sometimes helminths, and they stimulate the immune system. These include exotoxins and endotoxins. Exotoxins are protein toxins released by bacteria such as Clostridium species. They may enter through contaminated food as in botulism, be produced in the intestine during bacterial overgrowth as in enterotoxemia, or form in infected tissues such as in blackleg. A subgroup called enterotoxins affects the intestinal lining and causes diarrhea by disturbing fluid and electrolyte balance, commonly seen with enterotoxigenic E. coli in young animals. Endotoxins are heat-stable lipopolysaccharides that form part of the outer membrane of gram-negative bacteria and are released during bacterial growth or cell death. They usually remain in the gut but can enter the bloodstream when the intestinal barrier is damaged, such as in enteritis or intestinal obstruction, or from other sites like abscesses and mastitis. If the liver fails to clear large amounts, endotoxemia develops. In horses, this condition is commonly associated with intestinal diseases such as colitis, strangulation, or complications after foaling. Metabolic toxins accumulate when detoxification or excretion fails. This occurs in intestinal obstruction with toxin reabsorption, kidney failure with urea buildup causing uremia, and liver disease with impaired detoxification of amino acids and sulfur compounds. It also occurs in tissue damage with histamine release, ketosis with ketone buildup from abnormal fat metabolism, and lactic acidemia with acid buildup due to excess carbohydrates. In pathogenesis, accumulation of toxins in the blood produces widespread effects. First, toxins stimulate immune cells to release inflammatory mediators such as cytokines and prostaglandins, producing systemic signs. Second, toxins damage organs like the liver, kidneys, and endocrine glands, disrupting hormonal and enzymatic functions. Third, carbohydrate metabolism is impaired with reduced glucose utilization and tolerance. Fourth, protein breakdown increases, leading to muscle wasting and increased blood urea nitrogen. Fifth, platelets are affected, and substances like serotonin and histamine cause clotting abnormalities or hemorrhage. Sixth, some toxins act as antigens and trigger allergic or anaphylactic reactions. Finally, multiple systems are depressed including cardiovascular, nervous, urinary, gastrointestinal, musculoskeletal, and hemopoietic systems, which may progress to multiple organ failure. Clinically, toxemia presents with signs similar to septicemia, including fever, lethargy, depression, rapid breathing, increased heart rate, and pale mucous membranes. The key difference is that toxemia involves toxins in the blood with or without bacteria, while septicemia involves active microorganisms in the bloodstream. Laboratory findings support diagnosis and include hypoglycemia, increased blood urea nitrogen, and reduced glucose tolerance. Early stages show leukopenia, followed by leukocytosis, and chronic cases may show anemia. Endotoxins can be detected using sensitive tests such as the Limulus amoebocyte lysate test. For differential diagnosis, causes of toxemia must be distinguished using clinical signs and laboratory tests. It may resemble chemical poisoning such as arsenic toxicity, so examination of feed or gut contents is necessary to rule out toxic substances. Treatment should be rapid and targeted. The first step is removal or control of the toxin source using antitoxins, hyperimmune serum, or antibiotics. In severe toxemia or shock, strong bactericidal antibiotics should be avoided initially as they may increase toxin release, and bacteriostatic drugs such as neomycin, kanamycin, gentamicin, or penicillin are preferred. Symptomatic treatment includes managing shock with corticosteroids like dexamethasone or cortisone. Reducing fever with antipyretics. Supportive therapy is essential and includes fluids and electrolytes to correct dehydration and improve circulation, using normal saline, Ringer's solution, or lactated Ringer's. Diuretics may help eliminate toxins. In severe cases, whole blood or plasma may be required, along with plasma expanders like dextran. Additional support includes sodium bicarbonate for acidosis and calcium borogluconate for hypocalcemia. Early understanding and treatment are essential to prevent organ failure and save the animal's life. If you found this helpful, don't forget to like, subscribe, and stay tuned for more vet care updates.